Marius Miguel C. Vismonte, and I am a student nurse from San Beda University. And today, I will be demonstrating the injection process through the intradermal, subcutaneous, and intramuscular routes. But before anything else, the first thing that we need to do is to review the physician or qualified practitioner's order so that the drug is administered safely and correctly or appropriately. And then afterwards, we also need to review the information regarding the expected reaction to the allergen in order to anticipate the type of reaction that the client may have. And then afterwards, we also need to assess the indications for intramuscular, subcutaneous, and intradermal injections, including the client's allergy history, so that the nurse will not administer a substance to which the client is known to be sensitive at. And then afterwards, we also need to check the expiration date of the medication because the drug loses its potency over time. And then afterwards, we need to assess the client's knowledge regarding the medication to be received so that the client education may be tailored according to their needs. And then afterwards, we also need to assess the client's response to the discussion about an injection, since some clients may express anticipatory anxiety, which may increase the pain. And then the next thing that we need to do is to prepare all the materials and equipments needed for this demonstration. So the first thing that we need is our tuberculin syringe, and then we also need to make sure that these syringes are suitable for the prescribed dosage for our intradermal, intramuscular, and subcutaneous. And then afterwards, we also need to secure the needles that will be used, but in this case, the needles come with our syringes already, so we don't have to worry about it. So we need to make sure that our needles are 25 to 27 in gauge for our intradermal, and then 22 to 25 gauge for our intramuscular, and 25 to 30 gauge for our subcutaneous. And then afterwards, we also need to prepare our antiseptic solution together with our alcohol swabs. And then we also need to prepare the medication from an ampule or a vial. And then we also need to have the patient's medication card or medication administration record, and then our disposable gloves. And then the next thing that we need to do is to wash our hands and put on clean gloves. So again, in washing our hands, we can either wash it using soap and water if there are visible stains, but we can use the alcohol if there are no visible stains. So in this case, we will be using an isopropyl alcohol. And then don our clean gloves, which we have here in our bag. And then afterwards, in the patient setting, we also need to close the door or curtains around the bed, and we also need to keep the gown of the patient or the sheet within the bed drape over the patient's body. And then in the outpatient setting, we need to close the door to the exam or the treatment room. And then afterwards, we need to identify the client. And then the next thing that we need to do is to select the injection site for our intradermal route. So the first thing that we need to do is to inspect the skin for bruises, inflammation, presence of edema, masses, tenderness, and sites of previous injection. And then with that, we're going to use the forearm as the site. And then with that, we use 3 to 4 finger widths as an indication below the antecubital space and one hand width above the wrist on the inner aspect of the forearm. At this point, we will be using a 25 to 27 gauge needle, which we have here. So we're going to unwrap it and then get our syringe and then discard. After getting our syringe, we need to prepare already the medication prescribed by the doctor. So usually, the doctor prescribes 0.5 for intradermal. So we need to get the desired amount. After doing so, we need to place back the cap. So the next thing that we need to do is to assist the client into achieving a comfortable position. And then we also need to use an antiseptic swab. And then we need to use it to clean the site of injection in a circular motion, beginning from the inner, then going outwards. And then while holding the swab between the fingers of the non-dominant hand, we need to pull the cap from the needle. And then we need to administer the injection through following the steps. So we need to use the non-dominant hand to stretch the skin over using our forefinger and then thumb. And then we need to insert the needle slowly at a 5 to 15 degree angle with the bevel up until resistance is felt. And then after inserting, we need to advance no more than 1/8 inch below the skin. And then we need to make sure that the needle tip should be seen through the skin. So we need to keep in mind not to aspirate, and then slowly inject the medication, and then the resistance will be felt. And then we will notice a small bleb, like a mosquito bite forming under the skin surface. So we need to note that. And then after that, we need to withdraw the needle while applying a gentle pressure with the antiseptic swab. And we need to keep in mind not to massage the site. And then again, we need to assist the patient in a comfortable position. And then we need to discard the uncapped needle and the syringe in a safe receptacle. Now moving on, we're going to perform the subcutaneous injection. In performing the subcutaneous injection, we need to assess for the previous subcutaneous injections in order to rotate the sites and avoid repeating the same dose in the same site. So afterwards, we need to prepare our syringe. We need to open it and then discard the packaging. And then get the desired amount of medication. And then afterwards, we need to get an antiseptic swab to clean the skin, which will serve as the site of our injection. So in this case, we will be using the pork meat for our demonstration. So again, same with the previous one, we begin with the inner circle and then going outwards. And then while holding the swab between the fingers of the non-dominant hand, we need to pull the cap from the needle. And then in administering the injection, we need to hold the syringe between the thumb and the forefinger of the dominant hand like a dart. And then we need to inject the needle quickly and firmly like a dart at a 45 degree to 90 degree angle. And then the next thing we need to do is to inject it either in a 90 degree angle or a 45 degree angle. So in this case, we will be doing the 45 degree angle. And then after that, we need to grasp the lower end of the syringe with our non-dominant hand. And then we need to position our dominant hand into the end of the plunger and then do not move the syringe. We need to pull back the plunger to ascertain that the needle is not in a vein. If there is no blood that appears, we need to slowly inject the medication. Remember to inject it slowly. So the thing that we did is an aspiration. So in some cases, it is contraindicated with some medication. So with that, we need to check the pharmacy for further clarifications. And then after that, we need to quickly withdraw the needle while applying pressure with the antiseptic swab. So do not push down on the needle with the swab while withdrawing it. So because the rationale behind this, because it will produce more pain. And then gently massage the site. So some medications should not be massaged. And then again, we need to ask the pharmacy if these things are unclear. And then again, after that, we again need to assist our patient in a comfortable position. And then we need to discard the uncapped needle and the syringe in a disposable needle receptacle. Now that we're already done with the intradermal and then the subcutaneous, we're now going to begin with our intramuscular injection. So in this injection, we need to assist our client into a comfortable position. In this case, which is the intramuscular, there are different sites for injection. So for an instance, we have the vastus lateralis. In this, we need to ask our patient to lie flat or supine with the knee slightly flexed. For the ventrogluteal, we need to ask the patient to lie on her side or back with knee and hip slightly flexed. For dorsal gluteal, we need to ask the patient to lie prone with the feet turned inward or on side with upper knee and hip flex and place in front of the lower leg. And then for the deltoid, which serves as the most common site for the intramuscular, we need to ask the patient to stand with arm flex or relaxed at the side or sit with the lower arm relaxed on the lap or lie flat with the lower arm relaxed across the abdomen. And then afterwards, we need to prepare our syringe, which we have here. And I also have one that is already opened right here. So we're going to prepare our medication, but in this case, I will be using the sterile water again. So let's say that the attending physician requested 2 ml of medication. So we need to get the medication at an eye level to make sure that we achieve the correct dosage for this injection. And then afterwards, we need to prepare an antiseptic swab. And then we need to again clean the site of injection from the inner and then going out. Then afterwards, using our non-dominant hand, we need to place the cap of the needle in between of our fingers and then remove it. And then afterwards, we need to hold the syringe between the thumb and the forefinger of the dominant hand like a dart. And then we need to spread the skin tightly or pinch a generous section of tissue firmly for certain patients. And then afterwards, we need to inject the needle quickly and firmly like a dart and at a 90-degree angle. And then afterwards, we need to release the skin and then grasp the lower end of the syringe with the non-dominant hand and position the dominant hand on the end of the plunger and do not move the syringe. And then afterwards, we need to pull back on the plunger to ascertain if a needle is in a vein. If there is no blood that appears, we need to slowly inject the medication. So again, we perform aspiration in this type of insertion or injection. And then afterwards, we need to quickly withdraw the needle while applying pressure with the antiseptic swab. And then again, we need to gently massage the site. After massaging the site, we need to assist the client to, again, to a comfortable position. And then we need to discard the uncapped needle and the syringe in a safe receptacle. After performing the intramuscular, intradermal, and the subcutaneous, the next thing that we need to do is to remove our gloves. And then discard. And then of course, again, wash our hands. And then afterwards, the next thing that we need to do is to document the date, the time, the dose, the route, the site of medication, and the signature of the initials to confirm that we have done the procedure. And then afterwards, we also need to document the date and time of the skin reaction if we have done the intradermal. And then we also need to document the date and time of any systemic side effects of the medication. And if these things happen, we immediately need to report to the physician. And then after those things, we need to perform aftercare. And again, we need to provide privacy to our patient. So once again, this is Nurse Marius Miguel C. Vismonte. Thank you for watching and God bless.